at Johns Hopkins Medicine.
Known for groundbreaking research, teaching, and medical care.
Welcome to Questions and Answers about COVID-19 infection in children from Johns Hopkins Medicine. I'm Elizabeth Tracy.
And I'm Rachel Thornton, a practicing pediatrician and also a member of the faculty at Johns Hopkins.
Rachel, thank you so much for joining me today. I know this is an extraordinarily busy time. Thank you for taking the time out of your schedule.
Oh, it's my pleasure. Thank you for having me.
Of course. Let's talk about COVID-19 infection in children. Big problem?
Well, I mean, to parents, any infection in their child that could cause them illness is a problem. So I don't want to underplay how worried parents are about what's happening. And there's a variety of other problems or complications to daily life that our response to the pandemic is facing children and families with. In terms of the illness itself, and this is constantly evolving as we learn more, our sense so far is that in general, children do not seem to overall have extremely high risk of severe illness or death. But generalizations don't apply to every specific situation the same way.
And certainly there was a specific situation where we had the first infant death that was reported in Chicago.
Yes, and so the first thing I would say about that is just that my deepest condolences and sympathies are with the family that suffered that unspeakable loss. And I think every parent fears the worst when it comes to an unknown situation like this. And so I don't want to downplay the signs and symptoms that all parents should be looking out for in their children. That would make me, as a pediatrician, more concerned about them. So I think it's important to give that information to parents so they know what they're looking for, but also to put it in context so that the stress of worry and anxiety about the implications of infection don't get in the way of everyone's ability to respond and take the measures necessary to try and keep us all as safe as possible from the illness.
So why don't we review those then?
Sure. So in general, the first thing I would say is our general experience or our general advice to parents is that most of the symptoms that we know of for COVID-19 illness are things like cough, sore throat, fevers, body aches, sort of sometimes GI upset or diarrhea. These are things that I think any parent would recognize as kind of analogous to the flu. So the same kinds of things that children exhibit when they have the flu. We consider a fever in a child any temperature of 100.4 or higher. We have different thresholds of worry about fever depending on if we're talking about a young infant or we're talking about a school-age child or a teenager. When we get worried, so I think if a parent is worried their child might have these symptoms and it may be COVID-19, we want them to call their pediatrician's office first. The times where we would want them to take immediate action and seek medical care are if a child is having significant breathing problems related to their symptoms. So I specifically think in babies we worry about paroxysms of cough or just coughing repeatedly, unable to catch their breath, sometimes associated with bluishness around the mouth, or where they just look like they're putting in a lot of extra effort to breathe or to nurse or to take their bottle, and it just seems like their neck is moving a lot or their belly is moving or the muscles in their ribs just seem to be moving more dramatically than would be normal. Those things are signs of respiratory distress, and those are urgent situations. I think the other thing in a young baby that we always like to be cognizant of is they don't have a lot of ways to give us clues when something's not right. So if your baby is not feeding well, if they're not waking and playful the way they normally are, if they're not making wet diapers, the usual number, or they're not crying and making tears, those things can suggest dehydration, and that's also a concern in a young infant.
Are there also heightened concerns if a child already has a lung issue or asthma, for example?
Thank you for that. So I'm not sure that we have 100% clarity on asthma as a risk factor for more severe disease. And I think that particular risk factor, the information is evolving. What I recall from the most recent updates I've gotten from our infectious disease specialists here at Johns Hopkins is that asthma itself is not on that list of conditions that might make us concerned about higher risk. That being said, if a child's having significant respiratory distress, that is something that needs urgent medical attention, whether it's from COVID-19 or from all the pollen in the air that's triggering a lot of people's asthma and allergies. There are other groups of children that we worry about. So that includes any child who is getting treatment or has a known reduction in the functioning of their immune system. So someone who we would consider immunosuppressed is the medical term we use to describe that. That may include a lot of children who are getting treatment for cancer, for example. It may include children who are getting treatment with medicines that we know depress the functioning of the immune system, high-dose steroids or some other medicines that are used to suppress the immune system. And those kids we may have a higher threshold of concern for. I think it's also important to keep in mind that there may be children with significant developmental conditions that make it difficult for them to clear secretions or to cough effectively, and may make it also harder for us to know when they're really starting to get sick. And I have a lot of trust and confidence in the people who take care of those children on a daily basis at home, the parents, the nurses, et cetera, to be really tuned in to when they should be worried. And again, I think if it appears urgent, they should seek medical attention. If they're worried, but they're still able to manage at home and it doesn't seem to be getting sort of past their limit, then they should call their doctor and start a conversation about what to do, whether testing is indicated and the like.
Let's turn to some of the social aspects of all of us being quarantined at home. Children's normal activities are totally disrupted. Lots more FaceTime with parents and siblings if they are in the home also, and other people. How should parents talk to their kids about this, about the coronavirus?
Yeah, well, so I'm a proponent of developmentally appropriate, open, honest communication with children. I think we should give children credit that they're very insightful in a way that's consistent with, their understanding of the world. So they know things are different than they normally are in many instances. If they had a routine, for instance, going to school, going to childcare, having play dates, they know at this point in many parts of the country that that's not what's happening, that things are different than usual. And I would say, I think that in many places, kudos to the educational system and to teachers in preparation for school closings. I can say just in my own personal experience as a parent of a school-aged child, the schools also have been really attentive to explaining some of the hygiene practices that we're recommending, and also sort of giving developmentally appropriate language to children to understand that there's this virus out there, this germ out there that we don't know a lot about. So one place potentially to start is to ask your child what they already know or what they already understand about why things are different in our daily life these days. And that gives them a chance to sort of articulate it and explain it using their language, using their understanding. Something else we recommend, if you feel like you really need to sit them down and have a conversation and explain some things that they don't seem to already be aware of, finding a dedicated time to really not rush that process, but give the child the space to participate and to process and to share their knowledge is really important. And then I think I would also say, it's okay for them to have fears. It's okay for them to have emotions about it. It's hard as a parent to watch your child be worried or anxious, but giving them the space to express those feelings is really helpful. And then helping them understand all the things they can do to help keep everyone in their family safe is empowering. And they're simple things that I think a lot of kids are already familiar with from childcare settings, for those kids who are in childcare settings, because every winter during flu season, they get the hand sanitizer out, everybody practices washing their hands a lot, the sneezing in the elbow, all of those kinds of things are things that even young children can start to work on and master, and it gives them a sense that they're also helping keep everyone they care about safe.
Along those same lines, would that be a good way of explaining to them why maybe they shouldn't be seeing their grandparents right now?
Yeah, so I think that is, that's a really hard one. I think absolutely explaining to them in a way that, doesn't cause unnecessary anxiety, but just to say, one of the other things we can do as a family is help protect grandma and grandpa, because what we know is if older folks get this, there's a chance that it may be a more severe or more difficult disease or illness for them. So explaining that, that contact can still happen, but it's going to happen on a virtual platform or by telephone or writing letters. I think it's also another way to help keep those extended family members and other caregivers engaged, is kind of thinking about how you can create some kind of schedule or routine and making contact with them and checking in. But I think that that's, very hard. And in a lot of families, everyone lives in the same house, or that grandparent is a major source of childcare and support to the family. So, those kinds of, how that's handled has to be individualized to the needs of a specific family.
Since we're talking about transmission risk, then, can we turn to the risk that children may present to others as a vector of the virus?
Yeah, so this is something that I think we think about a lot, not just with children, but with young people. And frankly, with anyone who is infected but not symptomatic or mildly symptomatic, sort of feeling fine and doesn't recognize if they're having any symptoms or may not actually be having any. I think the science and the epidemiology about risk of infection in children, like how likely they are to catch this and transmit it, is evolving. So I don't want to speak authoritatively to detailed specifics about that, but I would say in pediatric practice, generally what we're telling folks is if your children have mild symptoms, so fever that's manageable and decreases with Tylenol, a mild cough or sore throat, that our recommendation in general is for you to sort of act like they're contagious, recognizing that we're probably not in a position where we're going to be doing diagnostic testing at this point for a lot of those children, but sort of act like they're contagious and isolate them from other family members as much as is feasible. And I'm a mom, so I know sometimes it's not very feasible, and that's where those other practices to really help folks minimize their risk of spreading it to other people in the household are important. And I think there is emerging evidence that there are people who carry the infection and don't really exhibit many symptoms at all. And I think that's a big part of why all of the measures have been enacted to try and keep us all generally apart from each other as much as possible. I think we think about that for those of us who are still going to work. It's sort of part of why we're extra far apart from each other here is,
yes,
one of us may, not realize that we're infected, and so we're doing everything we can to minimize that risk of transmission.
Another form of transmission that's been in the news lately has been the idea that a woman who's pregnant can transmit this infection either to her fetus or to her newborn.
Mm-hmm. Yes, so I think that there have been some case reports and published studies, mostly from the experience in China, touching on this topic. So transmission in the context of pregnancy, so like during pregnancy or in the immediate birthing process, we tend to refer to as vertical transmission from mother to child. And then there's also this question about, if a mom is infected herself and she's taking care of her newborn, what is the risk of her infecting the baby after birth? My understanding of what we know so far in this rapidly changing environment is that in general, babies of mothers who are documented to have COVID-19 infection tend to do quite well. They may have some respiratory symptoms, some viral pneumonia symptoms as newborns, but generally speaking, it's not my understanding that they're an exceptionally high risk population for some of the complications that we know to be the case in adults. When it comes to the question of, a mom who's taking care of a baby and starts to develop symptoms and is concerned it may be COVID-19, it's really important, as always, to talk to your OB provider as a mom and a recent postpartum mom who's still sort of recovering from the trauma of childbirth, to make sure you know whether or not you qualify to be tested, or to find out for certain whether or not your symptoms are from COVID-19. In the hospital, there are a variety of practices that different hospitals have in place if a mom comes in positive, and they may recommend short-term isolation after delivery. I think a lot of questions come up from moms who are desiring to breastfeed about what the risks might be related to that. And the CDC, as I understand it, has some guidance and recommendations for all of these things that I think we still personalize to the given situation of a mom and baby. So in the hospital, I think a lot of times there might be a recommendation for mom to pump the breast milk and then let someone who's not infectious give their infant pumped breast milk. There are some other recommendations that a mom who has symptoms can wear a mask, and that will help in minimizing her ability to transmit to her baby, and potentially to sort of keep as far away as possible in the interim between feeding periods. And then the hand hygiene and surface cleaning and cleaning of any pumping equipment and all of those things are also recommended. But this is I think, a difficult one, knowing all the other reasons why closeness between a newborn and, really both parents or any involved caregivers is really important for creating those bonds. But those are some of the safety recommendations as I understand them.
You brought up the issue of testing and a mom who suspects that she may have symptoms related to COVID-19. Testing, of course, is a big issue nationally for everyone who's concerned about COVID-19. How available is it for children?
Yes, so I mostly know the landscape in my own state and region. I think generally speaking, at this point, because testing is limited everywhere, the focus is on testing when we are particularly concerned that knowing the result is going to change our management and recommendations for a patient, or that testing is going to help us to protect other people from infection. One of my colleagues, a couple of my colleagues actually wrote a recent op-ed in the New York Times kind of explaining the public health rationale for testing and how that's different than what I think might be, a universal desire among parents to know for sure one way or the other whether COVID-19 is the culprit for their child's symptoms or not. So what I would say is, I think in general, it's a good first step if you're concerned that your child has symptoms, to call your primary care provider or pediatrician and get their advice. I think in instances where the symptoms are mild, most likely a child is not going to meet criteria to get tested. There are some programs that might have access specifically for children, but I think it's really important to understand that every test is also another potential opportunity for transmission. And so as part of our collective responsibility, we have to kind of balance how much that information is going to help us as a parent against the other potential risks of testing. In an ideal world, the test would be something that we're using proactively to identify people who have infection, to trace contacts, to do really strategic measures to try and prevent spread among people we know are either infectious or exposed. But for children who have mild symptoms who call our pediatric clinics, generally what we say is assume they're contagious and stay at home and try to keep them separated as much as possible from other family members until those symptoms go away. For kids who are vulnerable, like the kids I talked about earlier who have immune systems that aren't functioning, the way that a normal healthy child's immune system might function, those children might warrant testing. And then I think the other groups that we really want to make sure we're prioritizing are any kids who are having symptoms that might be COVID-19 or related to COVID-19, who are sick enough that we would want to take care of them in a hospital. And in that instance, knowing the test result is really important because it's going to determine where we put them in our hospital, what kind of protection the nurses and doctors and other healthcare staff have on when they're taking care of them, what kind of precautions our custodial staff and environmental services staff and dietary staff are using when entering or exiting or cleaning those rooms. And so that is a higher priority, I think, for testing when it comes to kids. And then the last thing I'll say is the timing in terms of how much time passes between getting the test and getting the results is also a really important thing to consider. So there are some tests available where the timing is, 24 to 48 hours for a result. There are other tests, as I understand it, that take about 5 days or so to get a result. And during those 5 days, we're going to recommend that you do exactly the same things that you would do even if you didn't have the test result. So I think it's another reason for us to it's hard for pediatricians to say no to parents when they really are concerned about something. But this is one of those instances where I think we're really trying to support pediatricians in, being consistent with recommendations and prioritizing that supply for the places where it's really going to impact our ability to protect others, where it's really going to change our decision-making process.
I think you've answered this question already, but here's my last question. What about interactions between children who are not suspected of having COVID-19 and other children?
Other children in
Anybody's
general?
Right, in general.
Okay, so just kids out in the community who are like stuck at home, maybe bored or getting cabin fever, but who are healthy, and should they be able to kind of interact in person with their friends? At this point, I think generally what we're saying is we would recommend no in-person play dates or in-person close contact between people from different households as much as possible. It's not easy for the kids or the parents, but parents can be creative in sort of setting up virtual meetings or play dates to help their kids stay connected to their friends, because I do think those social connections are really important for children's well-being and development. But I think that's the general message that we're trying to convey. I think this is the other message that in different places around the country, officials are trying to convey, that we know folks are home and want to get out and want to interact, but, contact sports and meeting up in playgrounds is not necessarily going to help with our preventing transmission, because those are kind of opportunities where a lot of different people are touching the same surface, and we know, this virus can last on surfaces, and so those things are not recommended at this time. But that's a hard message to convey to parents and to kids, honestly. Because those friendships and relationships with peers are so important.
How would you like to end? If you could give a message to all those parents out there and the kids who are old enough to appreciate what you're saying, what would you say?
Well, I would say, as a pediatrician, I always tell parents that their health and their well-being is essential for promoting the health and well-being of their children. And so I want them to know we're here for them too, that this is incredibly stressful on everyone and everywhere. And I just want to encourage them, to take time to try and deal with their own needs and to reach out if they're reaching a breaking point or feeling like the stress is too much to bear. And as pediatricians, we have a really active role in this, in emotional health and monitoring emotional health in the first year after birth. So in normal circumstances, we care a lot about postpartum depression and postpartum blues, because we know that a mom's ability to care for her baby after birth is critical to that baby's health. And in this instance, I think we should really be encouraging parents to do that emotional health check for themselves and to reach out to us so we can help them if they're starting to feel like it's more than they can bear, or they're sort of getting to their wits' end and not sure where to turn. So just to encourage parents to take care of themselves, and to encourage those kids who are old enough to kind of be thinking this through, to support mom and dad, to understand that everyone's, adjusting to these big changes, and wherever you can, do little things that can be helpful in keeping the household running smoothly. But we should never forget about parents, because they're so important, and caregivers generally who take care of kids, because they're so important to keeping our kids healthy and safe.
Including pediatricians. On that note, thank you so much for joining me, and thank you for joining us on this session of Questions about COVID-19 Infection in Children from Johns Hopkins Medicine.
Oh, thank you so much. Thanks, everyone.
Yes.